Hello, guys. Welcome to BM's Online Institute. My name is Dr. Maxwell Mvani, and today we'll be talking about the humerus. But before we dive into that, please remember to like, comment, and follow us on all our social media handles via Facebook and Instagram, and also on our YouTube channel. Please remember to like, comment, and subscribe to our YouTube channel. So, like I said, today we'll be talking about the humerus. All right, it's part of the series osteology of the upper limbs, right? We had started it with the clavicle, we went to the scapula. Now today we'll be talking about the humerus. So I'll be doing so using the following outline. Okay. So introduction, features, site determination, attachments, and then finally the clinical anatomy, why we study this bone. So by way of introduction, the humerus is a long bone. And as a matter of fact, it is the longest bone of the upper limb. I didn't say of the human body, I said of the upper limb. Okay. Now, it is also the bone of the arm. Okay. Now, gross anatomy, they say raise your arm in class or raise your hand in class. You do this, but anatomically speaking, from your wrist beyond is your hand, okay? From your elbow to your wrist is your forearm, okay? And then this is your arm. From the shoulder joint to the elbow joint, okay? So the bone of the arm is the humerus. It is found right here, all right? That's the bone we'll be talking about today. So under features, the way we are going to talk about this bone under features is we'll divide the bone into three parts: the upper end, the shaft, and the lower end, okay? So look at my diagram here. We have the upper end, all right? We have the upper end, we have the lower end, and finally, between the upper end and the lower end, we have the shaft, okay? This is the shaft. This is the upper end. And then this is the lower end. All right. So now let's proceed with the upper end. We'll start with the upper end, we'll proceed to the shaft, then to the lower end, and we'll be done with features. But for me to do that, I'm going to share my screen so that we can use the 3D model. Okay. We're going to use the 3D model. I hope you can see my screen. Okay. Now, like I said before, where my cursor is your scapula. This is the clavicle. This is the humerus, the bone of the arm. This is the forearm and the two bones located in the forearm, the radius, which is a lateral bone, and the ulna, which is the medial bone of the forearm. And then from here, the wrist joint below or beyond is your hand, having your carpal bones, metacarpal bones, and your phalanges. All right. So, but today we'll just be talking about the humerus. All right. So I'm going to isolate the humerus. Beautiful. Now, we are under features, and I said we'll be talking about the humerus under three headings. That is under features: head, the head, the shaft or the upper end, the shaft, and the lower end. So for the upper end, what are the things we can find out here? We realize that the upper end bears the head. It has the head that articulates with the humerus, okay? So this is the head right here. Let me show you from here so that you can zoom in. So this is your scapula, this is your humerus, and this is the head. okay, this portion here where my cursor is, you can see that it articulates with the glenoid cavity of the scapula, okay? So now the head also bears, or rather the upper end also bears the lesser tubercle and the greater tubercle. The lesser tubercle is found anteriorly, this is it, where my cursor is, while the greater tubercle is found more or less laterally, posteriorly, and somewhat a little bit anteriorly, okay? Look at the greater tubercle here, where my cursor is, and this is your lesser tubercle. In between these two tubercles, we have a groove here called the bicipital groove or your intertubercular sulcus, okay, which contains two things: the tendon of the long head of the biceps brachii, right, and also the ascending branch of the anterior circumflex humeral artery. All right, so there are two things here: the tendon of the long head of the biceps brachii and its synovial sheath, the sheath wrapping this tendon. And then we have the ascending branch. There's the anterior humeral that comes here where my cursor is. There's also posterior humeral circumflex artery. Now, the anterior gives a branch called the ascending branch, and it goes along this groove called the bicipital groove, okay? So now the junction between the head and the rest of the upper end, this line right here, is the anatomical neck, okay? While the line separating the whole of this upper end from the shaft, somewhere here, right, where my cursor is the surgical neck. All right, those are the two differences. So it has the anatomical neck and the surgical neck. It also has the morphological neck, which is the line, the epiphyseal line, and it's usually 0.5 cm below the surgical neck. All right, good. So look at the posterior view of the humerus, the head, right here, the anatomical neck right here, and then we have the greater tubercle, okay? This greater tubercle has three impressions: upper impression, middle impression, and the lower impression, okay? There are three muscles that attach there, and that's why I am highlighting that. Now, let's go to the shaft, right? Now, the shaft has three surfaces and three borders, okay? It has the anterior border, you can see right here. It is more prominent in the lower portion than in the upper portion. The upper portion, it is more or less rounded, okay? But going downwards, it becomes more prominent. So the anterior border, right, has the lateral border, and then we also have the medial border, okay? Now, it has, I told you, it has three surfaces. In between the anterior border and the medial border, we have the anteromedial surface right here, where my cursor is, while in between the anterior border and the lateral border, we have the anterolateral surface, okay? And then finally, between, let me show you the posterior view, between this, the lateral border and the medial border, behind, we have the posterior surface, okay? Good. So now, the medial border continues inferiorly down here as the medial supracondylar ridge. Okay, this is your medial supracondylar ridge, while the lateral continues as your lateral supracondylar ridge. Okay, so this border continues as the lateral supracondylar ridge. Same here, but called the medial supracondylar ridge. Now, the anterolateral surface bears a tuberosity. You can see this rough portion right here. Okay, this rough portion is your deltoid tuberosity. Okay, the deltoid tuberosity is located. Now, for your posterior surface, the posterior surface bears two important features. To rotate it. For the shaft, there's two important features. Now, you can see this groove right here, right? Where my cursor is. That is called the radial groove, okay? It's located posteriorly, that is on the posterior surface, the radial groove right here. There is also an oblique ridge. Can't really appreciate it using this diagram, but the oblique ridge is found above the radial groove. Okay, so it's somewhere here, an oblique ridge. You can see my cursor, it's oblique. That is not, it's not vertical, it's not horizontal. Okay, oblique. Now, those are the features that we can find on the posterior surface of the humerus. Now, let's now proceed to the lower end. The lower end, we can talk about the lower end under two headings. We have the articular part and the non-articular part. Articular means what? Joints, taking part in joints formation. Okay, so we have the part that is involved in formation of a joint, the elbow joint to be specific, while we have the part that is not involved in the formation of the elbow joint. So the articular part and the non-articular part. So let's start with the articular part. The articular part is one, the capitulum. You can see this rounded portion here where my cursor is. This is called the capitulum. Okay, it articulates with the head of the radius. Okay, now this other portion here where my cursor is medially is the trochlea, which goes to the it articulates with the ulnar bone. Okay, now the trochlear notch of the ulnar bone. Now this trochlea, you can appreciate that it has the medial edge. Now you can see that this medial edge, proceeds inferiorly more than the capitulum, right? I'm going to, let's use this now. You can see the capitulum articulating with the head of the radius, and then the trochlea articulating with the trochlear notch of the ulnar bone. This is the ulnar bone. Okay. Now you can see that this portion, the medial edge, is projecting downwards more than the base or the last portion of the humerus. Actually, more 6 cm below the base of this bone or the capitulum, where the capitulum ends. Okay. Now that gives rise to an angle called the carrying angle. If you look at this zoomed out diagram, you can see that the humerus comes this way, and then the forearm bends more laterally, if you look at it very well. Now, that angle, okay, that is formed as a result of this medial edge is called a carrying angle. Okay, in females, it's usually more. Okay, theoretically speaking, it's most likely due to the fact that females have wider hips. Okay, so the carrying angle is there. It's more in females to allow them swing their hands, all right, comfortably, because the hips will be somewhere here. According to my cursor, you look at my cursor, the hips will be somewhere here. Okay, so it's more in females. The forearm is more diverted so that there can be easy free flow of swinging of the limbs, the upper limbs. Okay, so that's the carrying angle. I just thought I should mention that. Now let's get back to the humerus. Now we've talked about the articular portion, which is this and this, the capitulum and the trochlea. Now just above the trochlea, we have a fossa, a depression right here. Now this depression is called the coronoid fossa. Okay, this is the coronoid fossa. While here, this other depression laterally, just above the capitulum, is called the radial fossa. All right. Now, posteriorly, or before we go posteriorly, this portion here, I told you this is the medial supracondylar ridge, and then this portion here is your medial epicondyle, while this is your lateral supracondylar ridge. Okay, is your lateral supracondylar ridge, and then here is your mid epicondyle, your lateral epicondyle rather. Okay, so posteriorly we have a fossa here just above the trochlea, but posteriorly, and that's called your olecranon fossa. All right, so this is that is the description of the lower end. So we've successfully described the humerus from the upper end to the shaft and then to the lower end. Now, the next is side determination. Okay, according to our outline for talking about this bone. Now, I told you side determination is simply knowing the left, okay, from the right, trying to tell which part or which side is the bone. Is it the left humerus or the right humerus? And to do so, I told you, just know the difference between the upper part from the lower, let's say, know the difference between the superior portion from the inferior portion, medial portion from the lateral portion, and then anterior from posterior. So for the humerus, once you see the head is always found superiorly. If you see this bone and it's kept this way, they give it to you and you're holding it this way, according to this my diagram here, this 3D bone, okay? This is pointing inferiorly, so it cannot be kept that way. You have to turn the bone to face superiorly, okay? Let the head face superiorly. Now, that is the difference between the superior portion from the inferior portion. Now, from medial, from lateral, the head always points medially. Take notes. It is always pointing medially, superiorly, and backwards. If you look at this diagram, let's do this so that you can appreciate it better. Okay. You can see that the head of the humerus is pointing medially, where it articulates with the glenoid cavity. It's also going upwards, okay, superiorly, and somewhat backwards, all right? Somewhat backwards. You can look at it, it's going somewhat backwards. Now, back to this bone. Now, I said the head is always pointing medially. So if this bone is facing this way, then that means this should be the medial portion. If it's facing this way, then that means it should be the medial portion this other way. Okay, so it's the difference between the medial aspect from the lateral aspect orienting. That's what I'm talking about. If you're trying to orient this bone in an anatomical position, the head should always point medially. Okay, if I hold the bone, it should point. The head should be facing towards my body, my midline. Okay. Now, difference between anterior from posterior is that we have the lesser tubercle on the anterior aspect. Once you locate the lesser tubercle, you should be facing anteriorly. Okay, once you do these three things, you will have oriented the bone in an anatomical position to either fit the left side or what the right side. And that is how you will know if it is the left bone, the left humerus, or the right humerus. Okay. So the next thing after site determination is attachments. So we're going to talk about attachments now. I'm going to go to muscles right here. Okay. Now, it looks complicated, right? But not that much. Now let's start with, I'm going to, okay. Now, you can see this muscle right here. This is called your brachialis muscle, okay? It is found on from the lower halves of the, look at it, this is the humerus, right? The lower half of the anterolateral and anteromedial surface, okay? That's where you have